Hello, everyone, and welcome back to the OET Speaking Practice Podcast. This podcast is designed to help healthcare professionals prepare for the OET speaking subtest, particularly the medicine role play. Our goal is to help you understand what the task is asking, how to structure your response, and how a high-scoring conversation sounds in real time. In each episode, we'll first set the scene by introducing a role-play scenario commonly seen in OET-style speaking practice. After that, you'll hear a model conversation between a healthcare professional and a patient or carer.
This is episode 12, and today's topic is about chronic hip pain. Let's review the clinical context. Our patient today is a 76-year-old who is overweight and has been suffering from right hip pain for several years. Recently, the pain has intensified, affecting their daily tasks, and they have started using a walking stick. The patient is quite anxious and looking for reassurance. As the doctor in this scenario, I have a specific list of tasks to cover during the consultation. First, I need to explain the possible causes of the symptoms, such as osteoarthritis, bursitis, or tendinitis. Then explain why the symptoms might be worsening. Inform the patient that hip pain is quite common in people over 65 and that arthritis is the most common cause. Also, I need to explain the diagnostic process and treatment options, ranging from weight loss and medication to physiotherapy, noting that surgery is a last resort. And finally, I need to outline what happens now, which includes the examination, the X-ray referral, and a follow-up appointment. Now, let's move into the model role-play conversation. Good morning, Arthur. I see from your notes that you've been having some trouble with your right hip. Could you tell me a little more about what's been going on?
Yes, doctor. It's been bothering me for years, really. But lately, it's just become unbearable. I can't do my simple everyday movements around the house without hurting. I've even had to start using this walking stick just to get around. I'm really worried about what this means.
I can certainly understand why you would be worried, Arthur, especially when it impacts your daily mobility like that. It is good that you came in so we can look at this together. You mentioned the pain has been there for years. Have you had any thoughts on what might be causing it?
Well, I assume the worst. Is it arthritis? Or is my hip just giving up on me?
It is very natural to jump to those conclusions. There are actually various possible causes for the symptoms you are experiencing. While osteoarthritis is indeed the most likely culprit given your symptoms, it could also be something like bursitis, tendinitis, or even referred pain coming from your back.
I see. But why is it getting so much worse now? I used to be able to manage it.
That is a great question. Often, symptoms worsen simply because the underlying cause has remained untreated for a long time. These conditions can be progressive if we don't intervene. But I want to reassure you that you aren't alone in this. Hip pain is actually quite common in people over the age of 65. And you were right to suspect it. Arthritis is indeed the most common cause in your age group.
Okay, that makes me feel a little less isolated, I suppose. But how do we know for sure what it is?
To get a definitive answer, we need to do two things. First, I'm going to perform a physical examination right here in the clinic to check your range of motion. Then, I will refer you for an X-ray specifically to check for signs of arthritis.
And if it is arthritis, what does that mean? Do I need a hip replacement? I'm terrified of surgery.
Please try not to worry about surgery just yet. The treatment really depends on the final diagnosis, but we usually start with conservative measures. If it is arthritis, we have many options before we even consider surgery. We would look at modification of your daily activities and perhaps using paracetamol or NSAIDs to manage the inflammation.
Is there anything else I can do?
Yes, actually. I notice from your chart that your weight is a little higher than ideal. Weight loss can be incredibly effective in reducing the pressure on your hip joint. We could also look into physiotherapy to strengthen the muscles. We would generally only consider a referral for hip replacement if all these conservative treatments fail to give you relief.
That is a relief, doctor. I'm happy to try the other things first. So, what should happen now?
Right now, we will proceed with a diagnostic examination. After I examine your hip, I'll give you the form for the X-ray. Once we have those results, we will schedule a follow-up appointment to confirm the diagnosis and finalize your treatment plan so we can monitor your progress. How does that sound?
That sounds like a solid plan. Thank you, doctor.
Thank you for listening to today's OET Speaking Practice podcast. As you listen and practice, focus on clear structure, empathetic communication, and simple, patient-friendly language. Try practicing this role play aloud, switching roles if possible, and timing yourself to match exam conditions. We hope this episode helps you feel more confident and prepared for your OET speaking test. Good luck with your preparation, and we'll see you in the next episode.